Hi, everybody. Thanks for joining us and for your ongoing partnership with Research America. I am so grateful today to be talking to one of our country's leaders on infectious disease response, Dr. Rima Khabbaz, who is the director of the CDC Center for Emerging and Zoonotic Infectious Diseases. I was just sharing with her when I first started working with her center, and I heard the term zoonotic diseases. I really didn't realize to what extent they really impact humans, and they do. And we're going to be learning more about that today. And not only are she and her colleagues working on the pandemic, but a number of other emerging threats simultaneously. So they certainly have a full plate. As usual, please type your questions into the Q&A box as we go along, and we'll gladly ask them when we get to the Q&A portion. And with that, let me turn it over to you, Dr. Khabbaz. Thank you so much for joining us.
Thank you, Jenny. And yes, if we can have the first slide, absolutely. So thank you so much for the chance to be with you. And thank you, Research America and your members, for all you do to advance medical and health research. It's really a pleasure to be here with you today. So I'm going to give you an overview actually of the work that we do in NCEZID, touch on our role in the CDC COVID-19 response, and also how we're looking at our mission to find a path forward more focused on outbreak and epidemic preparedness. Our mission is to protect people at home and around the world from emerging and zoonotic infections, and as we like to say, ranging from A to Z, right? Anthrax to Zika. So if we can have the next slide. We are a large center, and we work on a large number of pathogens, and we work with partners throughout the United States and around the world to prevent illnesses and deaths caused by infectious diseases. Our portfolio of work includes zoonotic infections. So it includes vector-borne diseases, but also a broad range of infections, healthcare-associated infections, antibiotic resistant ones, deadly and rare diseases like Ebola and smallpox, but also common ones, foodborne, waterborne, and fungal illnesses. And we're also responsible for quarantine, border and travel health. We have a One Health office in our center, and we have an advanced molecular detection program. And if we can go to the next slide. Can we go to the, yes, thank you. So I wanted to spend a minute talking about one of our top priorities, which is preventing and detecting vector-borne diseases. And these are on the rise in the United States. Between 2004 and 2018, the number of reported illnesses from mosquito, flea, and tick bites more than doubled, with more than 760,000 cases reported. We have 9 new germs spread by mosquito and ticks that were either discovered or introduced in the United States during this time. So we have a division of vector-borne diseases out of Fort Collins, Colorado, and that lead our work in that space. And so we address the vector-borne disease challenges by focusing on better understanding when, where, and how people are exposed and get sick from them. We also develop, evaluate, and improve tools and guidance for detection, prevention, and control, and disseminate and support the use of effective control products, tools, and programs against disease threats. Just to give you an example of innovative work in our program I'm proud of, our scientists in Fort Collins have worked to develop a natural product, Nucaton, actually, to look at it as a mosquito control product. And in partnership with a company, that product is now EPA approved and will add to the armamentarium of mosquito control products. So just an example here. Next slide, I wanted to touch on another big priority of ours, which is preventing healthcare-associated infections and addressing antibiotic resistance. This is a big priority of ours. It's among the US government's highest public health priorities. And we work closely with HHS and other agencies to lead on the Presidential Advisory Council on combating antibiotic resistant bacteria and the development of a national action plan. And to give you a sense, each year about 1 in 25 hospitalized patients in the US is diagnosed with at least one infection related to hospital care. And we also, every year, at least 2.8 million people in the United States get an antibiotic resistant infection, and more than 35,000 people die. And so we use data for action to prevent infection, improve antibiotic use, and protect patients. And some of our emerging research includes looking at the impact of COVID-19 on antibiotic resistance and healthcare-associated infections. And I want to mention a very recent study that we just recently published in Infection Control and Hospital Epidemiology, where we show a substantial increase nationally in some healthcare-associated infections and select antibiotic resistance in 2020 compared to 2019. So for most of these infections, these increases seen indicate that the pandemic may have actually reversed successes that we've had in preventing resistant infections in healthcare. COVID-19 has created actually the perfect storm of longer hospital stays, crowding, antibiotics frequently prescribed upon admission, and infection control challenges like PPE shortages. And so we will continue to invest in healthcare infection prevention, in training for all healthcare providers, and ensuring facilities and state and local partners have actionable data to ensure that people who need healthcare during the pandemic and beyond are able to receive that safe care. So next slide, we can, okay, so again, touching on advanced molecular detection, which is a program that we stood up 8 years ago when we were appropriated resources to integrate the latest next generation genomic sequencing into public health. And so we've been at this. I mean, this obviously is critically important to find, track, and stop pathogens faster than ever before. So we've been at it, investing in the latest lab and computing technology and building a workforce that's able to use that for public health, integrating it into public health work. And so AMD program has been critical to CDC's COVID-19 response and helped us detect and track SARS-CoV-2 variants. So last year, we established the SPHERES network. Basically, it stands for SARS-CoV-2 sequencing for public health emergency response, EPI, and surveillance, a long sentence. So SPHERES for short, a consortium and network that has really been key to help coordinate SARS-CoV-2 sequencing, sharing data. It involves 700 scientists from over 200 labs across the US that has really showed up what we can do. And as AMD and sequencing had become recognized as important, we've gotten resources and have been able to shore up what we do in AMD even more for COVID and others. So that's exciting. Next, quickly also to touch on another important priority, which is addressing climate change. Climate crisis and its impact on public health is an important top priority for CDC and for us. CDC stood up a task force in response to the president's executive order to address climate crisis. And we are a leader of this task force, co-leader. And our center is uniquely prepared and equipped to respond to the adverse effects of climate change related to infectious and environmentally transmitted diseases. So these diseases include the vectorborne diseases that I've already touched on, dengue, chikungunya, Lyme, fungal infections like histo and valley fever, and waterborne diseases like harmful algal bloom. So we have some top priority, for climate, including improving our surveillance system to better track disease, improving the systems to not just detect, but also respond to the diseases and be able to predict, model, and then be able to, so that we can more quickly move to mitigate the impact on those infections. Next, the last big priority that I wanted to touch on is health equity. And COVID-19 has shown, has highlighted how important it is in our country and how it impacts infectious diseases. And just to say that we are strengthening, we have an Office of Health Equity in my center, and we're strengthening its role to better support and promote health equity throughout our programs and science in the center. We're still setting priorities of what we're going to be focused on, but I can tell you, looking at our data, inventorying our data for gaps and opportunities to improve collection and analysis of data, that we can better focus, understand health disparities, and bring that information for, into our programs and practices, expanding partnerships, and including in our extramural cooperative agreements, and promoting diversity in our workforce are amongst our top priorities. And next, I quickly put, next slide, yes, I wanted to just put out there for you a new surveillance system that we stood up along with HHS, the National Wastewater Surveillance System. We stood it up to support the COVID-19 pandemic response. I'm excited. It's really an innovative, environmentally based surveillance system that brings new data, new way of looking at data to track spread of COVID-19 in communities and help inform public health responses. And it doesn't replace, but complement other systems. And so we're excited about it. In June, we awarded over $30 million to Public Health Department in support of the systems. And it's really a robust, adaptable platform to do this work and be able for us to offer technical assistance and look at national data and standardized data analysis and visualization. And we're looking to expand this system to look at other emerging threats in the future. Antibiotic resistance and enteric diseases are things that I think are ripe for looking at from that perspective. Next slide, quickly, because I want to leave time for questions, but to touch on our role in the COVID-19 response, to say how our center has really played an essential role leading major COVID-19 response activities, both in terms of staff that we've contributed, leadership staff to the CDC response, and systems and programs and relationships, basically all area of the response, whether it's epidemiology, laboratory, data analysis, healthcare systems, and all of the mitigation efforts. And while the pandemic is unique among modern CDC responses, right? I mean, it's just different than anything the world has dealt with. I can tell you that our center has taken on similar responsibilities in past responses, like fungal meningitis outbreaks, foodborne disease outbreaks, Ebola, Zika, hurricanes. So stepping in to do this is not new to us. And just to leave you with the next slide, I think it's my last slide. So while we're continuing to respond to COVID-19, we're also expanding our focus on outbreak and epidemic preparedness. And we've thought through the areas that we have primary responsibility for and areas that need focus, that have been critical in the COVID response. And we want to make sure that these areas are part of our center's ongoing capabilities, for COVID and for next major outbreaks and for the day-to-day. So these include a focus on healthcare systems, ensuring robust and consistent support to the healthcare systems on infection control and outbreak preparedness and response, looking at our quarantine capabilities, expanding and creating that modern multi-layered system that can provide the appropriate public health defense. And then also being part of building the infrastructure, supporting emerging infectious disease capacity preparedness and response at state and local level. And then last, in the area of lab, enhancing our ability to scale up and including future CDC test development and how we better engage and work with partners. And so with that, I'm going to stop so that we have time for your questions and discussion. Thanks again for allowing me to be here.
Thank you, Dr. Khabbaz. What a fascinating overview of all the many things you and your colleagues are working on to protect all of us. I'm going to ask my colleague Terry to join us on the screen. And while you're looking at the audience questions, Terry, I think I'll start with one. So you said, obviously you've been involved in many outbreaks, but that COVID-19 has been unlike any other that you and your colleagues have faced. How would you characterize the difference?
You know, Jenny, I mean, it's a pandemic. It's a pandemic like we've been talking about, or preparing for or worrying about, but its magnitude is like nothing we have seen, right? Us and the world. It's our worst nightmare that has unfolded. And so in terms of magnitude, in terms of complexity, it's unlike anything we've had to deal with. Now, the component of, you deal with it are, like I said, some commonalities with, some of what the other things that we've dealt with, but nothing like it.
Yeah, the sheer magnitude, for sure, and the impact. Yes. Terry.
Yeah, so as a reminder to those watching, you can click the Q&A button at the bottom of the screen and we'll see your questions. First question, on September 3rd, the White House released a statement on transforming the nation's capabilities for pandemic preparedness. Any thoughts on what that means for the center so far?
No, we're excited. Like there's been a lot of talk about and a lot of discussions at various levels in terms of transforming, and we've been part of those discussions. I mentioned the infrastructure, the domestic infrastructure for public health response. I think that's part of it, and so we look forward to be part of what the work that needs to be done to shore up what we can do. I also mentioned the advanced molecular detection sequencing. I think that's been recognized by the by everyone as critical to public health to do. We've seen the variant, unfold, and there's a lot of others. So I think it will. We look forward to be part of the work ahead.
Terry, do you mind if I just pick up on Dr. Khabbaz's point about genetic sequencing? You've been working, the CDC's been working to build this molecular capacity, not only internally, but also externally in our public health labs. How is that going? And, genetic sequencing, as we've learned, is critical to quickly identifying these pathogens. What more do we need to do to really get the access to that technology?
No, thank you, Jenny, for the question. So CDC, we commissioned a blue ribbon panel a few years ago. I basically was part of that where we, as the science and sequencing and next generation sequencing had evolved, public health had fallen behind. And so we were behind in terms of being able to integrate that science of sequencing in public health work. And so we got, back in 2014, 30 million appropriated for us to start building that capacity. And I think we've done well building it at CDC in terms of bringing the laboratory and the bioinformaticians to start doing more of this, and also in state and public health labs. So again, 30 million, across the board for all infectious diseases. But I think we had the start of what we could do. I think it's gone well. I can tell you that to date, all of our infectious disease programs have the capacity and use it. We've transformed PulseNet, which is the foodborne outbreak detection system, from what it was, pulse field gel electrophoresis, to be whole genome sequencing, that it can detect things faster. It's just quicker. And so it's gone well. It really needs, it's not just doing the sequencing, it's making sure that information is then weaved into public health so that we can act on it, and training, not just laboratorian, but also the epidemiologists and scientists on using it. And so I think we were well positioned when COVID came. I mean, but we had the capacity that we had, and we've been able to shore up, and we are continuing to shore up and partner with others to do more of that. So it's exciting. I think we're going to be able to even improve much more now that it's been recognized and more resources are coming to to be able to scale up even more.
Great, thank you, Terry.
That's actually a great lead into one of the questions we got, which first of all, thanks you for such a great overview, and then asks, are there areas where you see a need to grow or expand technological capabilities and then knowledge to address future threats? And are there areas that exist already that you would most like to see maybe expanded or enhanced?
Yeah, absolutely. Thank you for the question. So obviously the AMD is sequencing, and it is one area that's technologic. The programs, I've touched on some of those in terms of healthcare preparedness. I mean, I mentioned how we've fallen behind on some progress made in healthcare associated infections and antibiotic resistance. And infection training on infection prevention and control, it seems basic, but it's just been a huge gap in people's understanding of what to do. And so that's an area that is important to shore up. Then the border health and travelers' health and our system. We've been talking about this for a long time. We need an agile system to be able to get information to travelers and back from travelers and connect it to public health, and rather than having to do this on a piece of paper every time we have a case of measles come back, try to figure out who was on that plane and how do you reach them and in time to protect themselves. And with COVID, we've seen the importance of that. So that shoring up those capacities as well. And the whole public health infrastructure, the capacity to detect and respond and modernize data. There's been a lot of talk about data modernization. I've not touched on it, but it's terribly important for the work that we do, and we're engaged in CDC's work to do that, so that our systems are up to par with using the latest science, so that we can be more efficient and more agile. So that's just some examples of areas, and the laboratory, obviously. Yeah.
Great, thank you. So you mentioned travelers, which brings to mind another question, which is, of course, we've all seen what's happening in Afghanistan, and we now have the arrival of Afghan allies in the United States. With that travel across the borders, has the center been involved or supporting that resettlement in any way?
Yeah, thank you, Terry, for the question. Yes. For the ally resettlement travel, the Department of Homeland Security is the lead. We're working with them and with DoD absolutely to assist in evacuees and allies. The medical screening is the lane that we're responsible for, public health and recommendations for vaccines, and also where these groups land while they're being screened in the US. DoD run camps to make sure that that we prevent infectious diseases and address them as they come. So we're quite closely engaged on the effort.
Great. Now another question. We know, of course, COVID-19 can infect animals, and animals are usually not vaccinated against viruses. What does this mean in regard to possible future variants and vaccine boosters?
Oh, I mentioned in passing the One Health office. I didn't have time to say more about it, but that's our One Health office is focused on that, the animal-human interface and how to strengthen the relationship. And you're absolutely right. COVID has, is passing to wild animals here. We don't know what this means really. We just have to keep an eye, and there's a lot more of it transmitting between people. So So focus is on controlling it in people, but absolutely the spillage back, or not back, but spillage into animals and wildlife is something that we've seen. And like I said, we just need to keep an eye on it and understand it a little better.
Dr. Khabbaz, speaking of animals, animals also have played a role in antimicrobial resistance. And the CDC has long really been the lead agency in the federal government working to address this issue of increasing resistance to antimicrobials. You mentioned a new federal-wide effort. Would love to hear more about that. And also, for those of us, on the phone who are in the patient advocacy community and the research community, what can people do either individually or organizationally, particularly around stewardship, particularly around this issue of protecting the antibiotics we have so that we have time for the new ones to come online. How can we help you in this effort?
Yeah, thanks, Jenny, for these questions. So with regard to the animal, aspects and environmental aspect, just to say, give me a chance to say that antibiotic resistance is a One Health problem, right? I mean, I touched on aspects of it related to healthcare associated infections and the healthcare system, which amplifies it, and our use of it in patients. And but it also the use of antibiotics in animals. I mean, it's is important to treat, but there's been quite a bit of broader use of antibiotic, in animals and spillage into the environment that contribute to resistance. And so the response to it is a One Health response, and having to look at what needs to be done, not just on the human side, but on animals, and to address it in the environment as well. And we work with other partners on that and to address. In terms of stewardship and what we can do, I mean, antibiotics is unlike other medicines, right? It's a common good. I mean, it's used to treat you. So you have an infection or you're worried about it, so you use it, but it affects everyone around you, resistance in you and others. So I think to be on an individual level cognizant of what this means and work to change the expectation that it's not a benign, like, oh, why not? I may have a virus, but why not throw some antibiotics? That kind of broad overuse is actually what's driven resistance, right, around the world. And so we work with healthcare providers to educate population patients about it's important to use it where and when it's needed, but we shouldn't use it when it's not. And so I think to carry that on an individual, in our mind is important. So I don't know if that answers your question.
Yeah, no, that's really helpful. And you also mentioned that during COVID-19, we've seen an increase in healthcare associated infections, which can be some horrendous infections that often escape the antibiotics that we have, right? But also can help to contribute to resistance. So it seems like a very key time to really, redouble our efforts on AMR. And I'll just give a quick commercial. I mentioned this to Dr. Khabbaz before we started, but we have a terrific panel on the issue of AMR during our forum next week, which the forum is Monday, Tuesday, and Wednesday. And we'll be talking about the PASTOR Act, which will address, I think, a lot of these issues in addition to what the federal government is already working on. And you can register to our forum for no costs. You've probably gotten many emails, but register and you can just watch the content at your convenience. So I think we have time for another question or two. Terry?
Yes, sorry, it was muted. That is one other question that's come up is the issue around other disease outbreaks other than COVID. Are there other disease outbreaks that you're currently watching, and how have you managed to balance all of those other diseases on top of the demands of COVID?
Yeah, that's a good question. Yes, we've during COVID, we've had to respond to 2 Ebola outbreaks, right? One in DRC, international outbreaks, and one in Guinea. Thank God they're over, but the work is not over in terms of continuing to help with the surveillance and efforts to stay on top of it. So working internationally. We've had a number of foodborne outbreaks. You know, early on in the pandemic, I think the number of foodborne illnesses went down. I know it did in terms of both reporting, and it's complex whether people were not eating out as much, whether we're not getting sick or not seeking healthcare, or or so reporting. So, and then they picked up, and we've had a number of big outbreaks that we had, product related that we've had to field. We have an imported case of monkeypox, made it to Texas from Nigeria. Luckily, there hasn't been a huge amount of work to track contacts, but luckily there hasn't been any secondary transmission. This is just some examples. It's just been a lot more. So yes, we couldn't, and we had to keep our eyes on all of those threats as well as we could. And the way we dealt with it is as people deployed to the response, we had others step in to take on priority responsibilities to detect these and respond to these outbreaks. So we had to scale back on some of the, maybe less, more researchy, more things that could be put on hold and focus on just responding to what we had to. But it's just been, yes, very busy.
Sure. And just one quick follow-up on that before I hand it back to Jenny. Anything you can share with how the CDC is mobilizing around the response to the emerging situation around long COVID, as it's called, or sometimes post-acute sequelae of COVID-19?
No, we have quite a bit of work in that space. We've had a program in our center focused on chronic consequences of, unknown infections. And so, myalgic encephalitis, etc. So they stepped in to help as well. And then, so we have a range of program to try to understand long COVID, carry surveillance for it, and then also shore up to do some, training and education. It's a huge thing that's going to be with us, and we need to, build capacity to address it, understand it, and then figure out how we're going to deal with it.
I'm just going to pose one final question, and we appreciate your staying on just a couple minutes past the half hour. Dr. Khabbaz, you talked about the magnitude of COVID-19 being unique and unsurpassed. It's also put the CDC and other federal agencies addressing this issue, in the public eye in a way that perhaps is unsurpassed. And I just wonder what you and your colleagues have learned around public communication, and also what you can share with us, because many of those of us on this webinar do our own, public outreach.
Yeah, no, for better or for worse, I'd like to think for better, it's put us out in the public eye. I will say for most of us, we've just had to keep our eye on the ball of public health work, right? And have other focus on the communication and public messages. And sometimes what we do is being understood and appreciated, and often it's not. Mm-hmm. And when you have something like the pandemic or like other crisis, everyone is upset and angry and doesn't know how to deal with it. And so have to find a place, something to you feel in control by criticizing. And so we've been in the receipt of a lot of criticism, some of it probably justified and things that we could do better, do more, faster. And some of it misunderstood in terms of what we do. But I think that's where people come from. They like to blame. And so it's been out there. I mean, I think many others are just kept the focus on doing what we need to do. Certainly, public communication is an area that we should do better, I would say, in general, right? Yeah.
Well, we're all working on that.
Yeah.
Thank you so much, Dr. Khabbaz, for joining us. It's been a really informative and thoughtful conversation with you. So we want you to get back to your work, protecting us and others. And thank you and your team for all that you do.
You're welcome. Yeah.
You've been working long hours the past 2 years almost. So we thank you.
Thank you. Thank you for the opportunity. Appreciate it.
And before we end, just a couple of quick housekeeping items. Our next Alliance member call is on Monday, September 20th at 1. And we'll be joined by 2 senior members of the House ENC Health Subcommittee. They work for Chair Anna Eshoo, and they're supporting her work in authorizing ARPA-H. So they'll provide an update on that legislation, and we hope you will join us. And of course, got to make one more plug for the Research America National Health Research Forum next week. It's virtual, it's free, thanks to our sponsors, and full of fantastic conversations that you won't want to miss. I'm encouraging friends and colleagues to register so you have access to the content, which will be available for several weeks. So we hope to see you all next week or online, and we really appreciate your support of Research America. Thank you.